And thank you so much for joining our Cannabis in the Workplace webinar. We're so happy to have you here today. My name is Melanie, and I'm the Communications and Network Engagement Manager here at ONN. If you're new to the Ontario Nonprofit Network, welcome. We're so happy to have you here. ONN is a network representing the 58,000 nonprofits and charities in Ontario. We focus on public policy and advocacy work and really try to support the sector as a whole. If you're already a member with ONN, thanks for coming back. We hope that you're able to enjoy this webinar and make some great use of our other membership benefits, such as our $100 discount to nonprofit driven, or our future webinars that we'll be hosting this fall. If you experience any technical difficulties during this webinar, please feel free to restart your browser, and if it still isn't working, give our team a call. Our phone number is 416-642-5786. Now, before we get going, I'm just going to do a quick poll to see where everyone is from today. So we just want to see, where is your organization located? Are you in Northern or Eastern Ontario, Southwestern Ontario, from the GPA, such as Hamilton, Durham, York, or Peel regions, or are you joining us from outside of Ontario? Wonderful. So it's great to see so many people from across Ontario. We have people that are from the GTA primarily, but we also have people from Northern Ontario, so welcome. Now I would like to do a land acknowledgement. ONN recognizes that we are on the traditional territory of the Mississaugas of the New Credit. This land has been stewarded by many Indigenous peoples for time immemorial, including the Wendat and Haudenosaunee. Toronto is also part of the Métis homeland and home to many Indigenous peoples from across Turtle Island. So today we're going to be going over a few things, all relating to cannabis in the workplace. We're going to be discussing how nonprofits can respond by building policies and procedures for the workplace, and we're also going to review a few scenarios that you may come into. We'll be having time throughout the webinar where you can ask questions, so please feel free to use our question box or the chat function. And I'm very excited to introduce Jeanne today. So Jeanne has over 25 years in executive arts management experience. She's the owner and principal of Lesage Arts Management. She's a highly respected senior arts management professional with both national and international experience in festivals and multidisciplinary performing arts. She is a sought-after consultant, educator, and conference speaker, working across Canada with a unique specialization and expertise in arts human resources. Jeanne has an MBA in executive management with a specialization in management consulting. She's also registered as a certified human resources leader. Today, Jeanne will be sharing her expertise in human resources to help us discuss policies and processes regarding cannabis in the workplace. Thank you so much for joining us today.
Great, thanks, Melanie.
And so one last poll that we're going to do to see really who's joining us today. We want to see, how large is your organization? So do you have 5 employees or less? Are you 6 to 10 employees? Are you 11 to 50 employees? 51 to 100? Or do you have more than 100 employees? Wonderful. So we have a pretty wide range, pretty evenly spread, with a little bit more on the 51 to 100 employees. So it's great to see so many different types of organizations joining us today. And now I would like to pass it over.
Great. Okay. Thanks, Melanie. And so thank you so much for coming today. This is a large topic, and my goal today is for us to really kind of break this down so that you can walk away with some really good tools of knowing how to move forward, to understand it, and then to move forward with some tools. But please remember, and I'm so glad we did that poll, thank you, Melanie, it's really helpful for me to understand where you're calling in from and the size of your organization, please do remember wherever we're talking about any human resources issues, any kinds of legislation has different thresholds of compliance according to your size of organization, the size of payroll, type of organization. So we're really happy to share tools, but please be sure to get to know exactly what is applicable for your organization. And I'm not a lawyer, so of course now just a little bit of caveat and fine print, but this presentation and materials are not meant to replace due diligence of getting external advice. Sometimes knowing when to get proper customized HR and legal advice is really important. So seek that when you need it. Okay, so I wanted to step back for a second and really talk about, whenever we talk about any kind of human resources, policy, procedures, best practices, I'd like to step back and talk about where it fits into a larger continuum. So if we're setting any kind of policy in a nonprofit, and it's very specific to us and our organizations in a nonprofit, what should we think about? So I like to think about any kind of policy or processes or procedures as a continuum. So at the top, at the very top, of course, we need to understand our legal and legislative compliance. And back to those thresholds again, for our organization, where we're situated in the country, and I'm just glad to see, I think we're all in Ontario here. What is our required legal and legislative compliance? That is our baseline. And then the next level down, we also may have additional organizational policies that's set by our board and by management. And we have such a really interesting array of sizes of organizations, but I'm going to guess that boards are quite involved in the work that you do as nonprofits. Next level down, we might also think about what are the kinds of policies that we want to have that make us a best-in-class employer. What makes a really great workplace? And then, of course, even beyond ourselves, what about our own sector values? We're in a nonprofit sector, and I actually now look to the ONN's Decent Work Charter. What are the kinds of things that we want to do to be really great employers? And then you might have other considerations in terms of how you set your policy. And I think you can apply this to any kind of policy, not just what we're going to chat about today, which is about cannabis in the workplace. So buckle up. So we're now going to talk about laws and legislation. So before we can talk about how do you address cannabis in the workplace for your nonprofit, I'd like to walk us through the various laws and legislation that you need to consider. And just a quick reminder, you will get a copy of this deck, and you're actually going to get more detail than you see here with links to the legislators. So don't worry about madly writing down all of the links in the laws. We're going to have links for you, more detail. Just maybe now think about the outside of the framework here. So what are we talking about? So let's just make sure we walk this through. So as we all know, in 2018, the federal government of Canada legalized the production, distribution, sale, and possession of recreational cannabis. Now, this is recreational cannabis, and you're going to hear me talk a lot about recreational medical. So just a little spoiler alert there. Now, the medical use of cannabis Ontario continues as is. So that has not changed, but we will touch upon that. The new law is about recreational cannabis. And so at this point, a person can access cannabis for medical use by registering with Health Canada. That's the existing laws. But now, under the new recreational laws, adults who are 18 or 19 years of age or older can legally purchase, grow, and use a limited quantity of cannabis. And so that is what we're talking about today. And again, just as I said before, we really want to make sure that we have the distinction between recreational cannabis use and medicinal cannabis use. And that medicinal cannabis use is regulated by Health Canada. So again, distinctions are very important as we walk through this framework. So, and one more thing just to kind of step back on, the scope that we're going to talk about is about workers. So yes, there's absolutely could be some things about cannabis and smoking in the workplace in terms of if you have a venue, about your clients and your members, but today's focus is from an HR point of view, and so it's workers. But workers in a lot of places could be employees, could be contractors, could be board members and volunteers. Okay, so what is the applicable legislation? Let's walk this through. We're going to talk about 3 specific legislations that nonprofit employers should consider. The first one is the Smoke-Free Ontario Act. The second is the Ontario Human Rights Commission, and the third is Ontario Health and Safety. So let's walk through each of those and what that impact is and how do we apply it to our workplace. Okay, so and again, you're going to get these in slides in detail. So the Smoke-Free Ontario Act, which is new in 2017, is pretty clear. You cannot smoke or vape in any enclosed workplace, any enclosed public space, and any other places that are designated as smoke-free or vape-free. This could be tobacco, it could be cannabis. So this is about smoking. And by the Act's definition, the workplace can be very broad. The workplace itself can be any part of a building, structure, or vehicle with a roof that an employee works in or visits. So you see, the workplace could be a lot of different things. You could have a separate smoking vaping area, but there's very, very strict rules under the Act, and you do not have to provide this. This is an important point. You do not need to provide this space. So that was number one. Number two, Ontario Human Rights Commission. So the Ontario Human Rights Code is a law in the Canadian province of Ontario that gives all people equal rights and opportunities without discrimination in such specific areas as housing and employment. So what does that mean for our topic today, for cannabis in the workplace? In the case of cannabis in the workplace, the code protects people who use cannabis for a medical purpose related to a disability from discriminatory treatment. And the code also prohibits discrimination against people who are perceived to have an addiction to cannabis on the grounds of disability. So therefore, the people who use cannabis for a medical purpose related to a disability and people addicted to cannabis have the right to request a disability-related accommodation. And we're gonna walk through that in a second. So back again, this is one where it gets a little bit more tricky and a little bit more detailed. This, under the code, people that either have used cannabis for a medical purpose or have an addiction have the right not to be discriminated against based on this disability. So accommodation, what does that mean? An employer may get a request from a worker to request for an accommodation related to cannabis, which they're required to consider and deal with up to the point of undue hardship. And anybody that's sort of worked in the human rights framework before, you've seen these requests for accommodation in different realms, altered workspaces, things like that. And we know that undue hardship in this case, can come in a few different dimensions. Now, this is a very large topic, and I know we really want to focus on the cannabis in the workplace, but I want to make sure that we understand under that human rights rubric, that duty to accommodate, what we're understanding about that in terms of in cannabis is if an employee requests accommodation due to a disability, there's some key considerations that you may want to look at. Just things to think about. First of all, cannabis use does not always equal impairment. And we're going to talk a little bit about how this impacts things in the workplace. And accommodation does not mean that an employee can smoke in the office. And a request for accommodation process and the resulting accommodation is something that's a larger process that an employer and a worker goes through. And if there's questions, we're going to have some room for questions later on, and we can flesh this out if people have very, very specific questions. Again, want to make sure we kind of understand that framework. Okay, so that was number two. Number three, the third legislation that we want to think about is Ontario's Occupational Health and Safety Act. And we know the Health and Safety Act in different guises, and of course, we know that health and safety is outlining the roles and responsibilities of employers and workers in keeping workplaces safe and healthy. And of course, health and safety, people have the right to participate in the process, they have the right to refuse unsafe work, and they have the right to know about potential hazards. How does this relate to cannabis in the workplace? So when it comes to those core rights, the right to participate, the right to refuse, and the right to know, even as we talk about what does this mean for legalized cannabis in the workplace, and then at the same time there's maybe human rights, somebody may ask for accommodation, you also have health and safety saying, in order for employers to manage that health and safety, the issues that may come up will be related to impairment due to substance abuse or substance use in the workplace. And so, for example, and this will come to mind, and I think this is a pretty simple one to think about, someone who's impaired in the workplace for whatever reason, recreational, medicinal, they may have difficulty completing their work safely, and they could put others in danger. So this is, again, something that we need to walk through. So that was a very, very quick top line going through the 3 levels of the legislative framework. So again, we've got Smoke-Free Ontario, we've got the Ontario Human Rights Commission, and we've got Ontario Occupational Health and Safety. Okay, so what does that mean? So let's now try to break these down. And even from the piece that I started to talk to you about, don't these actually kind of sit in conflict if we're saying that, well, if I have a medicinal accommodation and I need to be able to use cannabis, but doesn't that conflict with health and safety? And what about smoking in the workplace? So how do they all fit together? So let's, again, try to break that down. So I want to talk now about, now that we're looking at these 3 frameworks and the 3 levels of legislation, what does it really mean in the workplace? So 1, we have the possibility of smoking in the workplace. And number 2, we have the possibility of impairment in the workplace. And so I'd like to look at these 2 dimensions across these 3 layers of legislation. So first up, smoking in the workplace. So in Ontario's especially, this is actually the simplest of the frameworks for us to look at. According to Smoke-Free Ontario, you cannot smoke or vape in any enclosed workspace, enclosed public space, or other places that are smoke-free. And there's not really a lot of exceptions here. We did have a discussion about, of course, the only thing that might be separate here is looking at cultural practices, say Indigenous cultural practices, smudging, things like that, which have a very, very different approach. That's not what we're talking about here. But when you're talking about smoking or vaping, same difference, whether it's tobacco or it's cannabis, separate from those cultural considerations. This says that you cannot smoke or vape in an enclosed workspace. So again, the one thing that we also talked about, maybe if you set up a smoking area, that's possible. They have very, very, very specific regulations about how you do that, but you are not obligated to set up a smoking area. Okay, next layer down, impairment in the workplace. So how do we handle impairment in the workplace against these legislations? So first, let's look at human rights. And I started to talk about under human rights, people a worker or an employee can approach the employer asking for an accommodation based on a code in human rights. So say, for example, if it's a accommodation for medical use based on a disability, or it could be based on addiction. So people who use cannabis for a medical purpose related to disability, again, they can ask for accommodation from the employer, and we'll talk about what some examples of that might be. But again, we always have to remember in that human rights legislation and that framework, an employee can ask an employer for an accommodation up to the point of undue hardship. So in the case of cannabis in the workplace, what could be seen as undue hardship for an employer? Well, what we can see is that there's clear health and safety risks. So for example, say an employee comes forward and asks for an accommodation because they need it for a disability, but they are somebody who operates a vehicle. So is that a health and safety risk? That's one example of something that would be an undue hardship where an employer could not grant that kind of accommodation. And the other one that comes up is excessive costs. So for example, in that case, when I said, do you need to set up a smoke-free, do you need to set up a smoking area, which of course Smoke-Free Ontario will tell you it has got quite a few physical requirements surrounding that. It might be very costly, especially for, we're looking at the size of your nonprofits, we know that there might be some budget issues. So the other undue hardship might be excessive costs. The other thing I want to bring up again, just to make sure we're clear about that, this accommodation for medical use is again for medical use. This does not involve recreational use of cannabis. Okay, how are we doing? A lot of information in here, and we're gonna go through this and we will pause for some specific questions. Okay, still in that second dimension about impairment in the workplace is again onto that health and safety. And we covered a little bit of this already in the human rights piece. But if we're concerned about there being impairment in the workplace with cannabis, so under the healthy legislation, really it's about managing the risk the risks and managing the safety of others. Because we know as employers, our obligation is to provide a safe workplace. And so what if through these other areas where somebody has said, well, I need to use the cannabis because of an accommodation request, but what if that does impinge upon health and safety? Because an employer, again, you need to provide a safe workplace, and it's important that you understand and assess any of the hazards that are in place. And so while there could be requests for accommodation under human rights, the employer also needs to manage the risks and safety of their workers. So what you can see with these three circles is sometimes you have what they might call competing priorities. So how do these all come together? I'd like to just bring up one more thought that's actually beyond the legislative factors, which is what happens about if there's impairment in the workplace, just about that human side and about all the work and people need to do their job and perform their work. So what about how you deal with unexcused absences, late arrivals, and inability to do the job properly, which is actually even separate from all of this. Okay, so let's take a pause. So what I think is good here, because I think it's important before we move on to how we can help you frame some policies and procedures, I think it's important that we clarify any questions that are about the legislation and or the framework.
Wonderful. So if you have any questions, please feel free to type it in the question box or the chat function right now. And I guess while we're waiting, I did have one quick question. When you were talking about the late absences, so what would someone be required to do in that situation where it is starting to affect their work ethic? So there's not undue hardship in the sense that there's a lot of money or health risks, but there is, that productivity as kind of a cost as well.
Absolutely. And that's where it's not within it. So if it's not come forward as a request for accommodation, it's not come forward in any other rubrics, then it's a performance management issue. So similar to if there was absences for any other reason, just as you would manage the performance of your employees about things are not getting done, they're being late, you would manage it in the same way.
Wonderful. So it doesn't look like we have any questions on legislation right now, but if you do have some later on, please feel free to add it into the chat function.
Yes. And just a reminder, so I just went back, sorry, I went back. Jumping slides on you. Just remember these three circles, again, as you try to zero in. Smoke-free Ontario, human rights, health and safety, and talking about smoking in the workplace and impairment. Okay, so that's all nice that you've belabored us with all that legislation, Jen, and now my head hurts. So what should you do? And I really want to acknowledge and understand that even in larger organizations, and I see we've got a nice mix here, I understand that there's not always a lot of resources in order to carry out all these areas that you need to do. So we're going to do one more poll. One more poll. Do you want me to read the language of the poll, or do you have it? Oh, right.
Perfect. So what we're wanting to know is, does your nonprofit have a policy to address cannabis in the workplace right now?
And that's all right, we're not keeping track, right? So if you say no, that's all right. That's good for us to know.
Amazing. So it seems kind of like almost a 50-50 split.
Oh, great.
And what's really interesting is that everyone did know whether they had a policy in place or not. So that kind of speaks to the audience of who we're talking to today.
Yeah, that's really super. And I think even the folks that do have policies, some folks had some policies in place prior to this new legalization of cannabis, and then it's just a matter of updating it with this new info. Okay, great. So let's dive in about what we think we should do. Okay, there we go. A reminder again about our continuum, about thinking about, and I really like to think when I work with my clients on human resources issues, again, it's like asking people to do 9 things again, because all of you are doing usually about 10 things at the same time, because everybody's so busy and we're often under-resourced. But really think about this continuum. What's our base minimum for compliance? But what are our policies that the board and management want to do? How do we be a best-in-class employer? And then what are our values as a sector? And then, of course, as always, when it comes to that legal and legislative compliance, checking about your own specific thresholds for your organization. So a good example is health and safety. We all know in Ontario, there's lots of requirements about either health and safety rep, health and safety committee, which is usually about the size of your organization, the size of your employees. Okay, so what can we do? So what are the steps that you can take? So for folks that don't have a policy, or even the folks that do have a policy and you need to either maybe do a refresh or even make sure that you're communicating that really clearly. So big thing, and I like to repeat this because I actually think it's a very important distinction that can help diminish a lot of the debate even at the top. Be really clear about distinguishing between recreational versus medical cannabis use. And with recreational, think of the use of an impairment of recreational cannabis in the same way that you might consider alcohol use. And again, back to your organization, there's some organizations, and this is about your own needs and your own, even your work culture. Some organizations are like, there's no alcohol on site, even at social events, and obviously being impaired on the job is something that's not appropriate. But in some cases, we all know we have events, we have donor events, we have galas, and so sometimes there needs to be alcohol. So you need to have the kinds of policies that make sense. But again, with recreational cannabis, just think of it in some ways that you might consider the alcohol use. The medical use, as we said, an employee requesting accommodation to use medical cannabis due to disability. This is really not changed. But if you don't have something in your policy that really kind of outlines how this works, this is a really great time to do it. And obviously, what you want to do is set and communicate really clear policy and procedures that first are understood and adopted by your board and management. And we all know in terms of working with boards, it's very, very important this comes from the top down, that the board buys into this, senior management buys into it, and it's communicated out. In a lot of cases, you want to make sure that there's explicit acceptance of the policy. Sometimes people put it in their employee manual or their employee handbook. Sometimes people reference it in the contract to say, yes, we agreed to this. And make sure that when you roll that out, you're rolling it out on a regular basis, you're reviewing it, and think back to remember when I said the workers definition could be employees, could be contractors, could be your board, could be your volunteers. Make sure that you're kind of thinking about all the folks involved and all the different kinds of workplaces. Okay, so what do you need in your policy? And I'm actually going to reference a really great resource from a firm called Williams HR Law. And again, you're going to get the link on this. And what they talk about is really looking at what are the kinds of things that should be included in a good drug and alcohol policy. And they include both here. Again, be clear about that medicinal use. You've heard me say that several times, so I think we got that by now. Be clear about medicinal use, which requires accommodation, and recreational use, which does not. Clearly state that recreational cannabis use and impairment will be prohibited in the workplace. So just be very, very clear about that. And then if applicable, set out policy about recreational cannabis in situations where the employer allows alcohol consumption. And I do bring this up a lot with nonprofit because again, you may see some examples of organizations where they're pretty much no impairment inducing substances at all. So they're even in social situations, there won't be alcohol, et cetera, et cetera. But we all know in our nonprofit, again, I use those examples, sometimes there's fundraising events, donor events, galas, where we know there's going to be alcohol. You can still set a policy in place that says what is reasonable amounts of consumption and making sure that there's that difference between consumption and impairment. So I think that's a really good distinction here. And to continue. So again, back to those with medical needs, state that you will accommodate those individuals with legitimate medical needs in good faith, because you want to make sure that people understand that if there are real accommodation needs under that human rights rubric, that you absolutely are open to that and they can come forward. Now, you can also be clear that if there's employees that are using medical cannabis, that may result in impairment, that you may require them to disclose that. And then of course, you do also need to make sure that you're saying in your policy that if they violate any of this policy, you need to state what that discipline might be, which could be any kind of discipline up to including termination of employee. So a sample policy. So again, and I think the Williams HR piece is really good to kind of walk you through what you might consider. And we do have some sample policy, even down to some clauses that we can share that you can use as a starting point, or if you already have one, you can look at that to see if you might want to kind of shape or shift or change what you have already. So you can include sections, again, here we are again, definition about recreational versus medicinal, and about smoking in the workplace, and about impairment. So being really clear about what those definitions are. Again, if you want to set a policy about consumption at sponsored events, so whether that's alcohol or cannabis, and also the use of potentially impairing medication, be really clear about that. And then also being really clear that you are there for assistance for your employees that have substance abuse issues, which again would be under that human rights rubric. And again, the consequences of a violation of this policy. So we do have I've created some specific clauses that I've reviewed with a lawyer that I'm happy to share with folks that are attending this webinar, and you'll receive that. But I think it's even good to understand those headings. Okay, so those are all the pieces that are the sample policies. So how do we build that policy and procedures with minimal or no resources? Because as we all know, again, if you don't have an HR department, which is often the case, or maybe if you don't have that resource on your board, and if you don't have a policy, so how are you going to do that with limited resources? So I want to kind of throw some ideas at you, and I think when we get into the discussion and the question, we'd like to hear from you as well about how you were able to build out your policy and procedures, and how did that go for you? But how the heck are we going to be able to do this? So unfortunately, one size does not fit all. And so you may be hearing me say, well, think about these 5 things at this dimension and these 3, But the case is, we can borrow existing templates and best practices, but you really need to make this your own. You really need to make this work for, again, not only your compliance and about your thresholds, but about the own culture of your organization. So how are you going to create those? One question I'd really like you to think about is, who's going to own this process in your nonprofit? Meaning, who's going to take this on? I understand, like, and again, looking at the size of the organizations, I'm going to guess that most of you do not have HR departments or HR staff members, or even like a 50% HR staff person. Maybe you do. But if you don't have that, who's going to own this in the nonprofit? Is there somebody that's a staff member with an aptitude or an interest in HR? Is there a board member that has got expertise in HR? Do you have a board governance committee? And in fact, I talk a lot with organizations about, because this will often end up falling to the executive director, the CEO, or the head. We know this, alongside the 9 other portfolios that you have to do. I totally understand that and get that. But unfortunately, somebody really needs to own it. And this is where I do talk about boards, where this is a really great place to look at your board composition to see, is this an expertise that you actually really need to help mitigate the risks in your organization? The other question I would ask is, do you have a health and safety committee? Do you have a health and safety committee or a health and safety rep, which of course will vary depending on the size of your organization. When it comes to cannabis policies, is this something that you can work through with the health and safety committee? Now, we saw that in those 3, the Venn diagrams with the circles, some of it falls in health and safety, some of it is human rights, and some of it's the Smoking Act. But if you already have a mechanism like health and safety, maybe this is something that they can take on as well. All right, now, next round out. What if there was some peer sharing and learning? So similar to coming together today, I think we've all seen this when peers and nonprofits get together. We're really good at sharing our learning and sharing what we've done. And I think it's great to kind of, if peers come together, but again, especially if you are similar in size, similar in structure, and maybe similar in complexity, to kind of maybe 3 to 4 organizations can come together to work on this together for a policy. Because again, you're not talking about applying any specific cases, but why not come together to share resources to create that policy? And just a reminder, again, those procedures and policies need to be clear and reasonable. And the reason I bring this up is we often have really well-meaning colleagues or board members that maybe they pull in the policy that's from their very, very large corporate structure, and it's a 40-page policy. And it's good and it's there and it's done, but is it appropriate for your organization? But also, is it clear and reasonable? I think policies just actually, they need to be readable and understandable by everybody that that is affected to them. Can a new employee or volunteer or board member clearly understand what to do? And again, reminder to confirm all your workplaces. So it's not just the office. It could be if there's work vehicles, if you have event spaces, if you have offsite, wherever you do your work. All right, so let's round on down to some scenarios. And so what I want to do, so just people can start to think about some questions that they have. I'm gonna put some scenarios to start us off. And then if people want to start typing in some very specific questions into the chat box, or if you want to kind of think about some very specific scenarios, or if you want to talk about some best practices about what you have done, start to think about that, and you're welcome to start typing them away in there now. But what I'm going to do now is we're going to walk through a few scenarios to get us started. All right. Okay. Scenario number 1. All right, so what if somebody says that it is their human right to use cannabis recreationally at work? So somebody has said, you know, I was reading this online, I saw that cannabis is now legal, this is my human right, because it's now legal and it's my human right to use it. So I'm gonna talk a little bit about both how you approach this from a policy point of view, but also just, you know, when you're working with your staff and your team and your employees, when you're working on these questions, I want to also sort of talk about how you approach the answer. I mean, because as we saw earlier in the deck, and we all now know, and we've studied our legislation, well, it's a hard no. It's like, well, you can't actually, it's not a human right to use cannabis recreationally at work. So we know that. However, what I might suggest is take that opportunity to kind of have a little educational moment with that person coming forward. Because I think you all know, I mean, yes, you need to be kind of firm and strict about, well, okay, it's actually not your human right because it's recreational cannabis, but think about how you can kind of sit down and talk it through with that person. Because first of all, I think there's lots of myths and misgivings about the legalization of cannabis. Now things have settled down a little bit because we've been into it for a little while, but it's good to kind of sit down and go, okay, let's review this together. And then I would actually ask you, do you have a policy that's super clear about all of this? So you can use that policy as a way to lay that out. If somebody does come forward, it's actually a great time to test that policy, to go, is that policy clear enough? And if you walk it through and you realize, you know what, I think we need to tweak the language a little bit on that policy. The other thing that I would like to suggest is that sometimes you don't know what's really behind something coming forward with somebody. So they may be coming forward and just saying, well, this is recreational, but you know, what if there was an underlying challenge or problem that this person did have coming forward? So I would be very gentle in the education piece, and whereas their question is specifically about recreational cannabis, maybe kind of just point them to the whole policy, including, hey, listen, you know what? If it was a human rights request for accommodation, here's what that process is. Because maybe it's something that they find challenging to come forward to talk to you about. So it's actually good to kind of make sure that you're taking that opportunity to kind of take them through that whole thing. Do you have any other questions about that one, Melanie?
No? I think that's great, yeah.
Okay.
Very applicable.
All right. Let's look at the next one. Okay, I've mentioned this one a couple times because I think this comes up in a lot of discussion that I have with clients. So what if we require our staff to be at events with alcohol or even possibly legal recreational cannabis? You know, I haven't seen this yet, but I don't think it's far off. I don't think it's far off that a sponsor at one of our donor events could be a legal cannabis provider. And so what do we do about those alcohol and legal recreational cannabis events? And we actually require our staff to be at that event. So let's break that down. Prior to the cannabis legalization, I had certainly seen occasion that there would be some alcohol policies that organizations might have. And some of you may have had these policies in place. So for example, again, talk about the donor event, talk about galas. For any nonprofits that on the performing arts sides, we know opening nights are classic for that, but even in all nonprofits, you have a launch, you have an event, there may or may not be alcohol. It's not unheard of that you set a policy that talks about your expectations about people's behavior while they're working. So for example, we're just talking about alcohol right now. It could be that you have a policy that states that when there are social events with alcohol, with outside people, and it is work, it's that distinction. This isn't the staff party, this is work. So you can say, we understand that there will be alcohol present. If alcohol is going to be imbibed, then it is important that the employee does not become impaired and is in control at all times. Now, some organizations may decide that from their point of view, they are going to ask their employees not to drink at this work event, and that's fine. But some people will think it's okay, but you can be clear about the impairment. In some cases, I've seen organizations also take another step further to say whenever there are formal work public events, that there will be sort of the manager on duty or supervisor on duty, so that there's maybe 1 or 2 or even 3 people that are the go-to people at that event and who will not be partaking in any alcohol. So if you think about that, if there was cannabis, I think you need to look at it in the same way. So we're talking about impairment. Now this is where it gets tougher, because arguably different people can have 1 drink, 2 drinks, and are they impaired, are they not impaired? It's very subjective. And with cannabis, it might be the same thing, because we're also talking about, it could be vaped, it could be smoked, it could be edibles. So we need to kind of be clear about whether or not you want to do that. And it's just, again, think about if your organization needs something like that. If you don't have a lot of these events that are work events that are social with outside people, then you may not need it. Yeah, anything good?
Okay. So we actually did have a question along that line. So what people are wondering is, do you have the right as an employer to say no altogether to recreational cannabis at an event? If, for example, you said alcohol is allowed, can you still say cannabis recreationally isn't?
It's a great question. I mean, yeah, it's a great question. And what I have seen when I was doing this research, looking at what both back to what the Government Canada has posted and what you're seeing with a lot of employment lawyers coming through, I have seen pieces of advice that have said, yes, you can say that there's no cannabis. Now, I might ask the question, why no cannabis, recreational cannabis, right? We're really clear, right? Recreational, I know, I've said this like 99 times, not medical, recreational. I might ask the question, for you, what is that difference? From what I have seen in the research, you are allowed to say that there is no impairment from cannabis. Now, if we remember, a lot of folks, you will probably, anybody that had a prior alcohol policy, you probably had a policy that talked about illegal drugs. And of course, it was easier to say, well, you can't have illegal drugs because they're illegal and they can't have them in their possession, which is separate from the impairment. So what I've seen from the research is that you can say no recreational cannabis at these work functions where they are working. Again, not a lawyer, check it out for yourself. But it is an interesting question. Well, what you're saying, you can have a drink, but you can't have cannabis? There's my non-answer for you. There's my non-answer. Yeah, it's a great question. It's a really, really, and again, that's why I go back to your own culture as an organization too. Really, I think it's really important. But I just think, make a decision about it, be really clear about it, and then communicate that super clearly to folks.
Amazing, thank you.
Great. Any other questions that we want to pepper in, or?
So there is a question, it's not related directly to this scenario, but someone's wondering, what if someone is using medical cannabis and it's impairing their work, but not from a safety point of view to others, but it is, lowering their productivity, as I said. Yeah. Can they do anything about it, or do they have to wait until it gets to the point where they can justify undue hardship?
It's such a great question, and I'm so glad I brought this other material with me. What's alarming is that there's a big thing with orange Post-it notes and lots of notes on here. So I just want to step back because when we've been talking through this material, when we talk about that accommodation piece, it's a very complex piece. And it's a lengthy, and I'm just going to step back if it's okay. I'd like to kind of step back a little bit and talk about the accommodation process, because this leads into, so what do you do? So again, an accommodation process is a lengthy and involved process. It's not just somebody coming in and saying, this is what's happening today. This is a formal process involving lots of steps. And there's ways that are really that you need to make sure that you're handling responding to an accommodation request. We of course want to look at doing it in place of dignity, because somebody's coming forward with a human rights issue, which is either about a disability or about addiction. We want to come up with an individual plan for that request for accommodation. And again, that person, that worker, that employee has come forward with a request for accommodation. We want to make sure that it's inclusive, so that we're looking at this accommodation plan in the right kind of way, and we want participation on both sides. So both the employer and the employee work together to come up with an accommodation plan. So when a request comes forward from an employee, the Ontario Human Rights Code lays out very clearly the ideal process. Now, ideally, an employee comes forward with a request in writing about the accommodation that they're requesting. Now, you need to allow for, there may be some verbal requests or discussions, but it's often, if possible, it's really good for that request to come in writing. And when they come forward, they ask which Ontario Human Rights Code that they're accessing in terms of the accommodation. They actually do have to share the reason why the accommodation is required, up to certain points about disclosure and privacy. And it's possible for the employer to ask for some kind of proof that existence of that need for the accommodation. So that could be doctor's notes or any kind of expertise to kind of say, yes, we have assessed that this is a real need and this is a fair accommodation. And then the employee will say, and these are the specific needs that I have for this accommodation. All of that info is collected on that needs and request basis. And if there's lots of important steps in here about confidentiality and disclosure, and then together they come up with that accommodation plan in writing. And I think that is, and the reason I'm stepping all the way back, because I think it's really important in that plan to allow for this very question, which is, okay, so they're not driving a forklift, they're not working with vulnerable populations, we don't think that there's a health and safety risk, but there's still a productivity issue. And this is where it becomes a delicate balance and a gentle art to kind of say, can we make this accommodation? Can we make it work? But there can be limits as to how far that goes in terms of that person's productivity in their work. And it doesn't mean that this allows for them just to have lengthy absences and lateness and things like that. And the monitoring of it is an important piece of it. So when this plan comes up, when you sit down together to write this accommodation plan, and you can see already, it's even me talking about it, it's a lengthy process. So you need to make sure that when you've drafted that plan, you've talked really specifically about what the monitoring of that plan is going to be. And so looking again about how that's going to happen. Now, so what is the line of productivity? I think that's a very, very good question. If things start to get very, very challenging, I think you need to kind of take it in steps. Make sure also, because the question that I would have for anybody that brought this question forward is, how is your existing performance review assessment and program? Do you have a performance management in place already to kind of talk about, here's the job and what needs to happen? I might suggest, are you able to kind of make any adjustments? And then when these changes happen, really having an open dialogue, because you've gone through this very lengthy process to kind of set a really good path in place, making sure that when things come up, there's an open dialogue, and making sure that you're able to talk it through with that employee like you would with any other performance management issue. Now, when is too far? Again, it's really hard for me to kind of say what that is, and sometimes you do need to get others involved, especially if, when I was saying that you're allowed to bring in medical expertise to talk about the exact accommodation needs, you might need to kind of bring that back in again to kind of say, okay, we've accommodated, we've done this, how is this going and how can we make those changes? So probably not as specific an answer as this person has asked for, but again, it goes back to that really good planning and that really open dialogue. That was a very long answer, sorry about that, but I think it's a really important distinction. I think these are the most challenging things that we need to deal with.
That's a lot of helpful information though.
Okay. I have another one unless we have a question.
No, we're good for the next one.
Okay. All right. What if one of my staff shows up and it looks like they're impaired? What do I do? And so I think it's not somebody that is, so let's just say off the bat, this is not somebody that's requested for an accommodation, and it's not anything like that. And so when your staff shows up and they look like they're impaired and you think it might be cannabis, whether it's smoked vaped or edibles, what do you do? Again, I do come back to that common sense piece about how would you have approached a staff member that shows up that looks like perhaps they're under the influence of alcohol. So it's not the fact they're not smoking or consuming, they're not in possession, but the fact is that they look impaired. So what do I do? So again, think about what you would do if you thought somebody was impaired with alcohol. I think you have to weigh your risks, of course. If it is somebody that is in that health and safety range where you think others are at risk, you obviously need to take a swifter action than if not, because I think you need to make sure that if there's any health and safety, you just make sure that that person and others, that you remove any potential for harm or risk right away. But it's also just kind of talking to them, saying, and I always use that the IU in performance management. Okay, it seems to me that from your behavior, I think something's going on. Do you want to talk about it? And this builds on your ongoing relationship with your staff. And I realize this is going to be different with different staff, because some people, you may have staff that are, hourly casual staff that come in, or you might have full-time staff, but I think it's important to kind of address it head on. And it's very important, though, not to kind of make judgments or to kind of make assumptions to say, are they impaired? It could be that they're on cough medicine because they've been fighting a cold. It could be. So the point is, we're not judging what is it that they've consumed. The point is that you're witnessing their behavior. So what you can do is you can say, I'm observing this behavior. Can we talk about that? I'm concerned. Does that make sense?
That does make sense.
Yeah.
So what would you do if someone wasn't, let's say, outwardly impaired, but they come back from, let's say, lunch, and they smell like they've been smoking cannabis? Yeah. Are you as an employer allowed to say that they can't do it during their lunch break, where that's technically not work hours?
Great question. And same question about alcohol. And I think, although I think there's two things here. This is a great question. So I actually just saw this recently on a case that I was reading, where they were a frontline person and they came from a second job. Their first job was actually working in a legal, not a grow up, but like a legal cannabis salesperson. And when they arrived at work, they smelled, and they may not have been consuming it, but they smelled, and it was a frontline working with kids in a community center. So I think it's, again, having the honest conversation, because if you break it down in terms of, if they came back from lunch being visibly impaired, which may have been from alcohol, and or if they smell like they've been either consuming alcohol or cannabis, I think you can break down those two things. Okay, I'm observing your behavior and you might be impaired. Can we talk about that? If you do have, especially with somebody who's a frontline worker where they're dealing with your clients or the public or things like that, like you have a dress code, like you may have something about appearance, you can kind of say, listen, I noticed that there's a smell of this. Don't know what that's from, but just concerned about that when it comes to how we deal with our public and our staff. And I think but you can hear me kind of saying, you're not making any judgment. Like, you are drunk, you are stoned, you have a problem. It's starting with, what are the behaviors that you're observing? Does that make sense? A little bit of a distinction?
Yes.
Just a way in to have the conversation.
Someone actually followed up asking, can you outright ask, have you been drinking or smoking, or is that taboo?
It's a great question. I think I would suggest, and this is the HR answer, I suggest you focus on, what I'm observing. I'm concerned that you are impaired. Does that make sense?
Yes. Because
it's not, because I go back to the alcohol thing. So somebody has one drink, somebody has two drinks, somebody has three drinks. Who's to say when you're impaired? And, when it comes to cannabis, like right now we have blood alcohol testing. I know cannabis, there's in different forms in the market about cannabis testing. And I don't believe on the market there has been here is the acceptable amount of cannabis impairment for driving or et cetera. I think I could be wrong about that. That's a very good thing to follow up for myself to follow up on. But I would go back to, again, this is from an HR point of view, from your employees, talk about your observation.
That's a perfect answer.
Yeah.
I think that answers that perfectly. Thank you.
Okay, I've got one more scenario, but I want to make sure that we jump to questions. Do we have any other questions that are?
Nope, we've answered all of them so far.
What if somebody says that they have a prescription for cannabis, so therefore it's medical and it's their right to be impaired at work? Okay. I think because of that last question, because we actually spoke very, very, very extensively about the accommodation piece, this to me is going back to say, okay, the accommodation process under human rights is a lengthy and complex process. So the point I'm trying to make with this scenario that I brought up is people may arrive and say, this is happening today, I have a prescription, I'm here, and I'm gonna get impaired right now. And what I want to kind of make sure that we're aware of is that you need to walk it back with them. And this is where having a good policy in place helps to kind of go, listen, I totally get it. We have a process and we need to follow that process. And it's not just a prescription in hand equals this is what I'm allowed to do, because it is a complex process. And so making sure that folks understand that, and maybe making sure that they understand that this is what they need to do. All right. Okay. Do we have any other questions? Is there anything else that folks want to, do any folks have any best practices about how they'd like to talk about really good resource, or how they framed a policy, or something that they did or found? Any kind of, questions are great, and also the go for the brag basket. Talk about something that you did that was great.
So we do have a follow-up question, not to from the third scenario. So going back to if someone wasn't impaired, but let's say they come back from lunch and then they smell of cannabis.
Yeah.
Your response before was saying, point out the behaviors, but if they're not impaired, there's no specific behavior other than them smelling. So are you allowed bringing that up, or is that something where they're allowed smoking recreational cannabis outside of work? Because outside of work hours for that half an hour.
Yeah, it's a great question. And I think that's why I sort of brought up the aligning that with something like dress code. And I think you need to weigh it against a couple different things. What is the job that they're doing? I mean, it does impact other folks, especially if most of us are in tight working spaces, so there's 4 people in one room or like in one open area. So sometimes scent and smell also affects other people. I find dress codes are often challenging in nonprofit. I think some people will have very specific dress codes according to the culture of your organization, some don't. And I wonder if we can kind of approach it from that point of view about where, I don't know what you're doing on your own time, et cetera, but I need you to know that there's a palpable smell that happens. And again, because it could be literally that they were in another space. It might have been that they were in another space, and you know what it's like. You're walking down the street and you absorb the smell. So we need to talk about that. So I think you have to frame the discussion, again, because it's not about impairment, it's not about consuming, possessing, but it's about, here's the impression, like a dress code, like somebody who's showing up to work, either dressed or comported, is that a word? Like the comportment, exhibiting the comportment of somebody that's ready to work. It's a great question.
Great.
These are really good questions.
Yeah, thank you for clarifying that.
Yeah.
So we're just coming to the end of the webinar. One of the last questions we had, which was just a little bit more of logistics, but they were wondering if you're able to send us some sample policies in the follow-up.
Yes. I have one sample policy that I'm happy to share with everybody. And I've got some links to a number of different pieces as well. And so I've got a big long list of references, including links to all of the legislations, including some really good links to some service groups that are specific to occupational health and safety and workplace health and safety, as well as human rights. And we will absolutely share those with you, because and then make it your own. So I love sharing and using existing templates, and then really have a good eye to it to make sure that you make it work for you. You review it with your board and with your team, and then make it your own. So the other thing that I might just suggest, just to kind of go through these last, is again, with all these webinars, and I really appreciate people taking an hour, because time is incredibly precious in our resource scarce environment. Maybe really think about, okay, so how can you proceed? What do you really need to do from this? What can be your next steps? Who can you involve? Is there somebody on your board who's loves governance and policy, and you can kind of engage them to get that going? What do you need to get yourself started? And what are some ways that you can just kind of now take this and roll with it and rock and roll and get her done? Okay. Anything else?
No, I think that's it.
Okay.
We just really want to thank you so much for taking the time to speak and share your expertise with everyone today. So we will be sending the slide deck and the recording following this, but we really hope that you stay connected with us at ONN. So we've added some links so that you can subscribe to our newsletter, follow us in social media, and we look forward to staying connected. Thank you so much, everyone. Have a great day.